Hey, deep diver. I see you've been digging deep into making those improvements in nutritional care actually stick. You've sent us a ton of research on sustainability and spread, like how to make those changes last and really take root in new places. And get this, we're diving into Chapter 11 of Interdisciplinary Nutritional Management and Care for Older Adults. And trust me, it's packed with insights you can use. Get ready for some serious aha moments. We're even taking a trip up north to Canada where some hospitals had amazing success with this.
It's crazy how sustainability and spread, they're not just like add-ons at the end. They have to be built into your whole approach right from the start.
Right. It's like planting a garden. You wouldn't just like scatter seeds and hope for the best. You'd prep the soil, think about sunlight and pick plants that actually do well where you live. So let's break down these concepts. We use terms like sustainability and spread all the time, but what do they really mean like practically, especially in the world of nutritional care?
That's a good point. Well, sustainability basically is like making sure the benefits of all the work you're doing continue. So those improvements become the norm, not just a temporary thing. They're woven into how things are done, even when other stuff changes around it.
Got it. And spread, that's about taking that success and replicating it somewhere new, right? Not just scaling it up in the same place, but adapting it for a whole different environment.
Exactly. It's like taking that garden plan you were talking about and tweaking it for a different region, different soil, different pests. You got to adapt to make it work.
And this is where our Canadian adventure comes in, the INPAC program. These hospitals totally nailed it when it came to both sustainability and spread.
They did. Their focus was on tackling malnutrition in hospitals. And they had this multidisciplinary team approach, which I think was key. Everyone was involved. Doctors, nurses, even the folks delivering meals had a role.
Okay, so there were a lot of moving parts. How did they make sure this wasn't just a one-hit wonder?
Well, what's really interesting is how they built such a strong case for change, but they did it in a super smart way. They didn't just use the same argument for everyone. They appealed to different motivations. So for some, it was about how common malnutrition is and how it impacts patients. For others, it was about the length of stay and the cost burden on the hospital. They knew how to talk to everybody.
It's like marketing. You got to know your audience. But it can't just be about getting people excited at the beginning. You got to keep them engaged for the long run.
Oh, for sure. And they did that by making sure to involve the people who would be most affected by the change. Like the admission nurses. They were the ones doing those initial nutrition screenings. So the INPAC team made sure those nurses were really involved in shaping how those screenings were done.
Yeah, that makes sense. So instead of just forcing something new on them, they made these nurses feel like they were part of the solution. I bet that helped with morale, too. But even with everyone on board, how did they make sure these changes didn't just get lost in the daily chaos of the hospital?
They were smart about it. They really made an effort to weave those changes into the workflows that were already there. It wasn't some extra thing piled on top of everything else they had to do. It became just the way things are done.
Okay, so talking practical, not just theoretical. Were there other things that made this whole thing work so well?
Context was a big one. They were really clever about how they aligned their efforts with the existing hospital regulations and priorities. They didn't try to reinvent the wheel. They worked within the system.
So it wasn't just about having a great program. It was about the fit, like finding the right puzzle piece. What about the people part of it all? I'm guessing relationships played a big role too?
Always. Building those strong relationships was huge throughout the whole process. From getting started to keeping those changes going, it was all about connection. They knew that sustainable change is a team sport,
Okay, loving this Canadian success story. But let's say another hospital hears about this and says, we want that too. How did they make the jump from one place to another? Was it just copy and paste?
Not quite. Remember that garden analogy? What works in one spot might need some adjustments in another.
Ah, I see what you mean. So what was their secret sauce when it came to spread?
They were really good at being responsive. When another hospital was like, hey, we want in on this, the INPAC team was ready to go. They'd share their blueprint, but they were also realistic. Each new place would have its own little quirks and differences.
So it's like a tailored suit, not something off the rack. They made sure it fit the new environment.
Exactly. It's about being flexible, adaptable. They also really stressed making sure the new location was ready for the change. You wouldn't, plant something before the last frost, right?
Makes sense. You need the right conditions. This is where it gets really interesting for me. What strategies worked for both sustainability and de-spread? Like, it feels like those two goals must have some shared DNA.
You're so right. One big thing is visibility. Having a dedicated team member who is consistently there, like really present, was crucial. Not just popping in every now and then, but really being there, boots on the ground.
So not just cheering from the sidelines, but actually being in the game. What did those folks actually do?
Oh, lots of things. They answered questions, provided support, kept the momentum going. It's all about being a resource, a guide, someone who really embodies the change you're trying to make.
Okay, so it's like having the program's values, like personified right there where it's happening. I'm also going to guess that champions played a big role.
Oh, huge. Champions are the heart and soul. They're the cheerleaders, the advocates, They keep the energy up, they fight for the program, and they're the ones who knock down those roadblocks that always pop up.
Yeah, every movement needs those passionate people, but I feel like there's a but coming.
Well, one thing the IMPAC experience highlighted was the danger of relying on just one champion, like a lone superhero. If they burn out or move on, things can fall apart.
Oh, that makes sense. You can't put all your eggs in one basket. So what do?
They spread the love. Having multiple champions is so important. It shares the responsibility, helps prevent burnout, and honestly, it just makes everything stronger. Plus, it helps develop leadership skills throughout the team.
Okay, I'm taking notes. So we're talking about building it into routines, tracking progress, and cultivating champions. But remember that stack of research you mentioned? I bet there are some tools and frameworks out there that can help us with all of this.
Absolutely. And don't get overwhelmed. You don't need to use everything under the sun. It's about finding what works for your specific situation.
Yeah, I've seen a few, like the Program Sustainability Assessment Tool, the PSAT, I think it's called. Is that a good one?
Oh, yeah. The PSAT is great. It helps you systematically assess your program's strengths and weaknesses and all those factors that are crucial for sustainability.
So it's like a checkup for your program. It gives you a diagnosis of what's working and what needs a little extra love. What about the NHS sustainability model? Have you heard of that one?
That one's fantastic, too. It's designed to be used throughout the whole process, so you're constantly checking in with sustainability. It's not just a one-time thing.
So it's like a GPS that keeps you on track. Speaking of the long haul, let's be real for a minute. We're all busy.
Yeah.
Sometimes it feels like all this is just one more thing to add to an already overflowing to-do list.
I hear you. That's why it's so important to try to make sustainability and spread part of your everyday routines. Small, consistent actions, not a huge overhaul.
Okay, so it's like those tiny habits that can make a big difference over time. What's an example of that?
Well, when you're onboarding new staff, for example, just take a few minutes to talk about the program. Not just the how-to, but the why, the impact it's having.
Like those quick chats the Canadians were doing.
Yes, exactly. It plants the seed early on and just reinforces how important it is. It doesn't have to be anything formal. Just a quick chat can make a world of difference.
Okay, so those small, consistent steps, I'm getting it. Now, what about those audits for measuring progress? Any tips to make those less scary?
Once the initial changes are kind of settled in, you don't have to audit as often. The Canadians actually found that less is more.
So it's like checking the oil in your car, not rebuilding the engine every month.
Exactly. You're just looking for any red flags, any areas that might need a little boost. Reviewing data, like how many people are getting screened or just getting feedback from staff, can tell you a lot.
And if those numbers are dropping or people are getting frustrated, that's our cue for those booster activities, right?
Exactly. And you can tailor those boosters to whatever challenges you're seeing. Maybe it's a quick refresher training or a little visual reminder in the break room, or even just a team huddle to brainstorm some solutions.
So it's like giving the program a vitamin boost when it's feeling a bit sluggish. Okay, loving these practical tips. But back to those champions for a second. How do we actually find these amazing people? Do we have to put out a casting call?
Sometimes they find you. Passion is contagious, and a lot of times the people who are most excited will naturally step up.
So we create the space, and they rise to the occasion. I like it. But how do we help them thrive once they do emerge?
It's all about empowerment. Recognize their contributions, give them ownership, make sure they have the resources they need. And remember, it's not about creating one superstar, it's about a team of champions.
Right, no lone wolves here. We're talking about a whole pack of passionate people working together. Speaking of working together, we've been talking a lot about hospitals, but how do all these principles apply to different settings?
That's what's so great about these concepts. You can use them in community programs, schools, even workplaces. The principles are the same, but you might need to tweak the strategies a bit to fit that environment.
So like tailoring that suit again. Can you give us an example?
Absolutely. Let's say we're talking about schools. You want to improve the nutritional environment there. You could totally use that IMPAC framework, but adapt it. You'd involve teachers, parents, even the students themselves.
And I bet those champion networks would be amazing in a school setting. teachers who are passionate about healthy eating, students leading the charge for better cafeteria options.
Exactly. You tap into that existing energy and watch it spread. It's about making healthy eating fun and engaging, not just another rule.
And instead of hospital audits, maybe you're looking at how many students are participating in those healthy eating programs or asking families for their feedback.
Right. It's about finding creative ways to measure what matters in that specific setting. And just like with hospitals, equity is a huge consideration.
Oh, that's so true. We can't forget about the students who might not have the same access to healthy food. We need to make sure our efforts are helping everyone.
Absolutely. It might involve working with local organizations, pushing for policy changes, or just finding innovative ways to get rid of those barriers.
I'm getting so many ideas. But I also know there are some things to watch out for, some common mistakes people make when they're trying to make these changes last.
One of the biggest ones is trying to do too much too fast. It's better to start small, focus on a few key things, and build from there. Yeah, it's like those small steps we were talking about. Don't bite off more than you can chew. What else? Oh, another big one is forgetting to involve the people who will actually be affected by the changes. You need that buy-in, and it has to come from everybody.
Right. It can't just be some order from the top. It's got to be a team effort. Anything else we should watch out for?
Don't think that one size fits all. Just because something was a huge success in one place doesn't mean it'll work perfectly somewhere else. That's where that adaptability comes in, like we were talking about before.
Got it. So we're being flexible, we're making sure everyone's included, and we're starting small but thinking big. This has been so insightful. But before we wrap up our deep dive, I want to go back to something you said earlier about applying these principles beyond just hospitals. It's really got me thinking.
Ooh, I'm all ears. What are you thinking about?
Well, we talked about schools, but what about taking it even further, like to a whole community?
Now you're talking. That's the big picture. How would you see that playing out?
Imagine everyone working together, like healthcare people, schools, community groups, businesses, and of course the people who actually live there.
Yeah, it's like creating this web of support where everyone's on the same page, working towards the same goal, a healthier community from the inside out.
Exactly. And you wouldn't just come in and start telling people what to do. You'd start by listening,
Yeah.
figuring out what that community needs, what their strengths are, what challenges they're facing. You'd look at data on things like what people are eating, how easy it is to get healthy food, really get feel for what's going on.
That data can be so powerful. It helps you figure out where to put your energy, where you'll make the biggest difference.
And then you go from there. Maybe it's about helping out those farmers markets or community gardens that are already there, or maybe it's about creating new programs that encourage healthy eating. And of course, we'd need those amazing champions, just like in the hospitals.
Oh, they're out there. It could be anyone. Community leaders, doctors and nurses, parents, teachers, even young people who are passionate about making a change.
It's all about giving them the power to lead. And just like we talked about with hospitals and schools, we got to make sure things are fair.
Right? We have to think about those differences in access to good food, education, about nutrition, healthcare, all of that.
Exactly. It might mean working with organizations that help people who are struggling, or maybe it means pushing for changes in policies to make things more just. It's about making sure everyone has the opportunity to be healthy.
It all comes back to those basic principles: building a strong case, working together, empowering those champions, and making healthy habits a part of everyday life.
This is what I love about doing these deep dives. It's not just about learning new stuff. It's about imagining what's possible. And this idea of a community coming together around nutrition, that's powerful stuff.
It really is. And it all starts with that little spark, that willingness to do something, to believe that things can change.
It's so true. I'm walking away with so many ideas, and I'm really feeling hopeful. I can't wait to see what you accomplish out there, deep diver. Keep learning, keep exploring, and keep making a difference. And remember, we're here to help you along the way.
Until next time, happy diving.